A couple things too, Mike, in its cases, and it's something that has changed. Something that has happened with this COVID is telehealth and the changes that we have advanced in telehealth. Speaking with Children's Hospital and working with them, they say in 2019, they've done more in the first 6 months of 2020, they have done more telehealth than they have in all of 2019. The other piece I want to put in there is I talked to a family that has 2 children with disabilities. The availability and for them to work from their home and speak with their daughter or son is incredible for them. And I mean, it takes such a burden off of getting around. I do also want to add, back to the pre-existing condition piece. We had a father call in, and I've worked with him, and he had a 1-year-old daughter that's been fighting it's a life-threatening disease. Worked for 3 months trying to get some sort of medication and work with that. And I just want to read real quick. He reached out to us, and he sent a thank you note to me, and I have been in contact with him also. The very next day, desperate, he reached out. The very next day, we received a call. Because of the work you did, my daughter is receiving treatment on Tuesday. Over just a short couple of days, you changed our family forever and saved our daughter's life. She is doing well. They sent a picture of her on the playground recently, so I just want to add, that's how healthcare works, and that's what we're supposed to do.
This year, a lot of people are satisfied with their current health care. Yeah. They may not like the bill they get every month, but they're fairly satisfied with what they're getting. What do you say to them who are afraid that your plan or any plan that allows for more government involvement will limit their choice, limit their plans?
The government's already involved in our health care. And I support the Affordable Care Act, which allows you to keep your private plan if that's what you want. But there are so many people in the middle. So to qualify for Medicaid, you have to make, I think it's $22,000 a year for a family of 2. That's $22,000 a year. What about everybody who, let's take a waitress who makes $30,000 a year. She doesn't work full-time. She can't get benefits. What are her options? To go to the marketplace? When I shopped on the marketplace, the health care plan for my family of 6, and this is the average cost I found out, it's about $2,000 a month, $1,700 to $2,000 a month. We cannot afford health care. My son broke his arm last summer in your district, Mr. Balderson, and he broke his arm, and the bill is $13,000, And so one person can't fix that. We've got to work together. We have to work across the aisle. We have to make this not a political issue, and we have to just figure out how to get through this as a country. It's a crisis right now. The healthcare system is falling apart, and, it's part of our infrastructure. So the government does have to be involved. That's why I love, living here. I want my federal government to at least make sure that we can afford basic needs like health care.